Hi everyone, my name is Katie and I'm with the Arthritis Patient Advisory Board of Arthritis Research Canada in Vancouver, BC. And I'm here today with Sabrina Cavallo, who's a pediatric occupational therapist, and she's going to discuss some of her research findings and some of the discussions at the CRAs. So we're really excited to have you here with us, Sabrina. Thanks for coming.
Thanks for having me.
So first of all, can you tell us a little bit about yourself and how you became involved in the field of rheumatology?
Sure. So as you mentioned, I am an occupational therapist by trade. I worked at the Montreal Children's Hospital for about a decade, and during that period of time I worked with the rheumatology team there. So I worked with children and teenagers living with arthritis, from JIA to AS as well, so all of those different rheumatology diseases. After that, I actually continued with my master's degree. So as a clinician, I wanted to do research, and my wonderful supervisor at the time was working in JIA, so I joined her on a project that was actually looking at how the severity of JIA would impact not only parental coping, but quality of life and function amongst those with JIA. And I actually pursued that line of research in my PhD, where I looked at the factors that would could be related, could be associated with participation not only in physical activity, but also in leisure amongst children and teenagers with JIA. So, in a nutshell, I've essentially always been involved with JIA.
It's really interesting. What do you think are some of the key takeaway messages from your presentation, which you just gave, by the way, which is really exciting and stimulated a lot of discussion over physical activity in JIA? And it was about evidence-based clinical practice guidelines for physical activity in the management of JIA.
Well, I think certainly one of the key messages is there is that evidence out there. Part of our study was to actually garner that evidence and create a compendium of information, which we did, which are the evidence-based clinical practice guidelines on physical activity for those with JIA. But also another, one of the key messages is that they can't just be used alone, right? They inform decision-making. We're kind of part of this puzzle. So you have the evidence-based clinical practice guidelines, and then you have what the patient might want to do, preferences, what kind of resources are available, and also the clinicians in terms of resources, not only the clinicians as well, so be it the rheumatologists, the OTs, the PTs, the nurses that are involved, and all of these pieces, if you will inform and help the patient make their decision. So as I mentioned, we're kind of, the evidence base is kind of is part of it. It's not the do-all or end-all.
Right, and you need that multidisciplinary team to really implement everything.
Yes.
Mm-hmm. And for children living with JIA, where do they start if they want to participate in physical activity?
Well, I think certainly one of the things is discussing it with their healthcare professional. It doesn't, I mean, again, especially when you have an interdisciplinary team, you can speak to all of the people that are involved. So, and for younger children, you may have to do that with parents. So the parents may have to approach healthcare professionals, again, rheumatologists, nurses, OTs, PTs, and depending on the clinic, then they actually might talk about what the best thing is with you, with the patient as well. So I think that's one of the first steps. And actually just looking at what could be interesting to them. What do they want to do? I think, and in terms of preference, but also realizing that physical activity is not necessarily a bad thing.
Mm-hmm.
It can actually help, depending on what. So this is why I'm saying, like discussion, figure out what you want to do, and also discuss with your team, rheumatology team.
Right, not being afraid to
bring
it up
no.
and have the discussion.
No, exactly.
Mm-hmm. And what do you think are some of the most exciting and important things coming out of the CRAs this year?
I love the idea, again, the whole idea of having, considering sports and physical activity as medicine. It's great how far we've kind of, in terms of like the JIA literature and whatnot, in terms of the practice, how far we've come in saying, okay, instead of saying, no, you have arthritis, you can't do anything. Now it's like, okay, right now, maybe there are limits, maybe you can't do everything you want to do, but maybe there are things that you can do. So being active is not necessarily a bad thing. Again, it's, every individual is different, every disease affects individuals differently. And in terms, I think the other great, I know the theme of the meeting is sustainability. So I think for our work, we're still working towards figuring that out, but nevertheless, how do we sustain this kind of either knowledge translation? How do we sustain these kinds of programs? How do we sustain delivering these kinds of messages? So again, I think that's a very important point, and it has to do with networking and having multiple people working with you. So clinicians, patients, policymakers, and I think that's, I think in order to sustain all of this, you need everybody working together.
Right, and equipping patients with the tools and the knowledge they need to not be afraid and go out and try.
Absolutely.
Try what works for them.
Yeah.
And what do you think about the use of social media? I know this came up in your presentation as well, in relation to patient care.
In relation to patient care, I think certainly for us, the first few steps in terms of using social media is really to see if this is something that can help inform. So help, we're looking at teenagers specifically with JIA, and we were considering Facebook. We can see if that can actually help them tap into the existing information. So maybe, not necessarily to engage solely in the activities that we've proposed, but at least to say, well, those activities were, undertaken by people or participated in by people who have JIA, just like me, and there were benefits. So maybe there's something to this. Maybe I can ask, again, go back to your team and see, well, I kind of saw this thing, and it's been proven to help. Is it good for me? Can I try it? Or is there other stuff I can try? So I think in terms of social media, certainly that's one of the ways that, especially for teenagers, that they can tap into that kind of information. And also in terms of social media, you can, there's a lot of, what's the word I'm looking for? Socializing is possible, right? They can communicate with each other, with their peers. So
yeah, because it's such an isolating disease, and that it's a way to bridge the gap.
Absolutely, yeah, and that's it. And it's something that's accessible to, what teenager now doesn't have social media, or in some way access to social media, right? I think in general, kids are quite involved in social media, maybe a little too much, depending on, I don't know. But, so that's it, yeah, I think.
So yeah, using tools they already have to their advantage.
That's right.
And
what's appealing exactly to them. That's it.
What's going to work to implement and continue everything. So where do you see arthritis treatment and models of care and healthcare kind of moving within the next 10 years?
I think it's going to continue on this path of maybe less, there's always a biomedical aspect of it. Of course, you can't detach yourself from that, but there's more than just that. There is, the psychosocial aspect of it as well. There is, okay, so I have a disease, fine, but that doesn't necessarily, I don't have JIA, but, doesn't necessarily define who the person is. That's part of, and then, they want to be involved, and they, so to kind of move away from the very, again, I think it's continuing on this path and move away from the very biomedical and strictly biomedical, and kind of look at what else in terms of not only in terms of treatment, but in terms of also who's involved as well, right? Like interdisciplinary teams, more and more, there are various professionals that are being added to the rheumatology team, so rheumatologists, nurses, PTs, OTs, maybe social workers, psychologists, so all these people working together to treat in part the disease, but also treat the symptoms, not only the symptoms, again, related to what's physical, but maybe what's more emotional, what's more social.
So a more holistic approach.
Absolutely. I really think we're going to keep going on that path.
Yeah. And finally, what lifestyle tips do you have to offer for patients watching today?
What lifestyle? I was going to Again, I think don't be afraid of asking questions, and don't be afraid of, being active, even if it's a little bit. Even if it's, just a short walk, even if, just see what feels right for you, but certainly don't make activity, however, like I said, however little it may seem to you, your enemy. I think being active is important, and get sleep. Sleep well. Coming from someone who hasn't slept.
Yeah, it's hard to get enough sleep with the CRs. Well, thanks so much, Sabrina, for joining us today and for giving some tips and advice to everyone watching.
So, Katie, we have one question.
Okay.
How can kids with JIA help their friends and classmates understand their disease so that, they can essentially have an easier life at school?
I think part of that can also be through parents and teachers and the teenager or the child with JIA maybe have a meeting that way. Certainly inform, right? Inform and educate. So be it through the teachers or be it through, sometimes you can get pamphlets that are offered to children and teenagers with JIA explaining what this is. But I really do think that educating is the best way to understand that I do have, I have this disease, and this is and sometimes, for instance, I can't run like I used to be able to run, or I can't run, but it doesn't mean that I don't want to participate. It doesn't mean I'm not the same person. So I think educating via, like I said, through teachers, I think that's an important step.
Any more questions from the audience?
Yeah. When does a child, it's juvenile idiopathic arthritis, JIA, what kind of age do you begin to call it AS or AR, or do you never? Is it always JIA?
If you've been diagnosed with JIA before 16, then it's JIA. At least that's my,
Perfect.
That's what,
I know
so it could be as of, a couple of months, right, in terms of JIA. So
the research is
there's still people who are diagnosed.
JIA.
Yeah, at least that's what I've seen, yes.
Thank you.
Okay, thanks again, Sabrina.
Thank you so much.
Enjoy the rest of the conference.
Thanks.